Welcome back to Body Beautiful. We have plastic surgeon Dr. Joseph Mele here. He's talking about breast augmentations this segment. And first, let me remind you that we'll be taking your calls live with any questions you have for Dr. Mele. And the number to call, 800-440-4884. We'll also be posting the number for the doctor's office coming up at the end of the segment. This caveat we always give, but any advice we give you, certainly you're going to want to consult with your own physician as well. I want to jump right into the calls. Okay. Because a lot of people want to know about breast augmentations. It's a very popular surgery. Let's go to Jennifer from San Jose. Good morning, Jennifer.
Hi, Dr. Mele.
Good morning.
An often asked question, saline versus silicone, especially in regards to the scarring that often forms.
Sure. Saline versus silicone, it has to do with the filler that's inside the shell. The shells are pretty similar. They're both a silicone shell. The saline implant, I call it the honest implant, because the thing I worry about most is not so much the scarring as leakage. And if a saline implant leaks, it's like a water balloon. The water just leaks right out, so we know with the lack of volume that's happened. The gel implant's a little harder to tell. The gel can stay within the scar that forms around the implant, and it makes it difficult to know if there is a leak. Plus, the gel is pretty sticky. It's cohesive, so it doesn't flow like water does. In terms of scarring, in the past, the silicone gel-filled implants had about twice the rate of scarring as the saline-filled implants. And by scarring, it's not what you see on the outside, it's what forms around the implant itself. And if that scar becomes tight, it can make the breast feel hard or even move the position of the implant. The majority of the time that doesn't happen, but when it does, it may require surgery in order to fix it.
Okay. You know, there was a controversy some years ago about the silicone.
Sure.
And that's, I don't know if you want to address that.
There were concerns that the silicone could cause cancer, could cause scleroderma, lupus, some of the connective tissue disorders. That's been shown not to be true at this point. There's been large enough studies to compare women who are matched for age, looking at those problems with implants, without implants. And we find the same numbers in both groups.
Some, women that have the implants certainly prefer the silicone just because it feels more natural.
That's the big advantage of the gel implants, especially in the reconstructive arena where there isn't as much tissue to cover an implant. The gel implants tend to feel softer and more like a breast does. Saline tends to be a little stiffer and can wrinkle sometimes and give rippling.
Did you find that people went and swapped them out?
Well, it's interesting because when there was this huge controversy and there wasn't as much scientific data showing that the problems that were being said were not true, a lot of women changed from gel to saline, and many of them were not happy because of the way it felt. Then the controversy kind of settled down, and I've seen more women sort of right after that who came back for the gel implants because they like the way that they feel so much better. Well,
in the news, and I pulled this up, Christina Applegate,
yes,
the star, was diagnosed with breast cancer. And because she has breast cancer in the family, she opted for, it's like a prophylactic surgery, to actually take both breasts. She's only 36 years old.
Well, she's a young woman. I don't know if they've done any genetic testing, but certainly you can tell just from family history whether there's a history of young people in the family having cancer. There are indicators, there are tests that can be done to look for these cancer genes, and if they're there, it increases the risk of getting a second cancer.
So she, for her health, opted to...
and probably for peace of mind.
Right.
To have both removed so she doesn't have to be as concerned about breast cancer coming back.
Which has got to be very traumatic, but it is done. So do you do reconstructive surgery? Obviously, she has now the option to, I've read that she actually is going to have that done. She's going to have breast augmentation.
And it's totally elective. There was a time when most women did not have any reconstruction. They live without their breasts, and certainly you can function without breasts. You can use an external prosthesis, like a big padded bra, and that works okay as long as you're wearing clothing. Out of clothing in bathing suits, it's tough. Reconstruction now is done more than half of the time, and there are different areas where you can reconstruct. You can reconstruct just the mound, you can reconstruct the nipple, the areola, you can get to each level of detail. And I find that for the women who desire that, they just feel so much better, they feel more complete.
Yeah, and how much time do they have to wait after the mastectomy?
It can be started during the mastectomy surgery. So there was a time when there was actually a time when you were diagnosed as having a lump in your breast, you went to surgery and didn't know whether you were going to wake up with a mastectomy, with a biopsy, because we didn't know that leaving the biopsy site alone for a while didn't cause trouble. Then we found out you can leave it in there, come back later, do a mastectomy, and then there was concerns that reconstruction would interfere with discovery of recurrences. We've pretty much gotten around that hurdle, and now, so for most women, we can start reconstruction at the same time.
All right. We've got the calls. They're stacking up here, and you also brought some pictures that we need to go to a quick break.
Sure.
But if you want more information about Dr. Joseph Mele, you can call 925-943-6343 or go to drmele.com. First 25 callers who mention Body Beautiful will be eligible to receive a complimentary consultation. And when we come back on Body Beautiful, we'll continue our chat about breast augmentation with Dr. Mele, and we'll be taking your phone calls right after this.